Good Samaritan Regional Medical Center uses the AIO positioning and immobilization solution for head and neck cancers, SRS-SRT whole and partial brain cancer, as well as lung, breast, and abdominal cancers. Here, Kelli describes which cases and treatments are best suited for the AIO solution.
The best cases and treatments that are best suited for the all-in-one solution for us are the head and neck treatments. We use it for our brain setups, our SBRT, SRT setups. Those are really nice because the double layer mask that we use allows a lot of support for the patient. So there's not a whole lot of pitch and roll for them. And it also gives them a little bit more comfort as well. So we have less patients that are having issues with claustrophobia. So another setup that we're able to use Orfit for is compression setups for abdomen. So we weren't able to use compression for our patients prior to this, but we're actually able to use it for our patients' lower lungs that we want to keep their respiration rate pretty low, or anything in the stomach that we want to try to minimize movement. We're able to use the Orfit masks. They're kind of like a pelvis mask, so we use it for the abdomen, and we're able to use that for a compression setup. I kind of joke around that it's like a big Lego set that we can just put pieces together if we need to elevate them on a wedge, or if we need to adjust their arm a little bit. It's super easy to kind of play with all the pieces to figure out what's most comfortable for them. For our head and neck setups, we'll do the all-in-one Orfit, just the flat frame. We usually give a blue pad to our patients just for a little bit more comfort. And we'll do the 5-point mask. So we do the head with the shoulders. And one of the headrests, we kind of play around with what's best. Typically the number 2 headrest is kind of our like standard, and then we can adjust from there. We also have customizable headrests that we can use if patients have a hard time getting their head all the way back. We also use the 4-centimeter block quite a bit, just to lift their head up a little bit farther if they can't lay their head back flat so much. A tip and trick that I would definitely like to pass along, because we kind of found out the hard way, was that sometimes, like if you're treating in the abdomen, so like think, upper L spine or liver or something just in the center, to index it a little bit higher on the table just to make sure that you have clearance with your long. Because of just the handles with the Orfit system, it pushes the patient down just a little bit. And so sometimes we can't get into the table far enough with the long. I mean, it's super easy. You just index it up one little notch on the table and you're fine and you're clear. You don't hit anything. But that's definitely a tip and trick that I would say to keep in mind when you're treating your patient.